get angry about things. Then I go on to work. Toni Morrison. Back in 2018, I was working for a well-known academic medical institution right here in New York City. And the department that I was working in at the time was the most toxic and taxing environment for me as a Black woman. So much so that I was breaking out in hives daily because of the immense stress I felt having to deal with the institutional racism I both experienced and witnessed. I was also disturbed knowing that an institution so esteemed for delivering quality care had people in leadership who were blatantly prejudiced towards people of color. And some of these people were clinicians. When I reflect back on that season of my life, I can't help but think about just how much racism literally affects the health of those subjected to it. At the time, I was going back and forth to see an allergist who was running a series of tests on me, but who still couldn't identify what was triggering the hives. So she ended up prescribing me an over-the-counter medication, 2 Allegras, every single day. Now, I knew that this wasn't an optimal solution for me because I still had unanswered questions about what was going on with my body. But my doctor, who happened to be a white woman, seemed to be content with the solution she offered me. Not once did she ask if I was dealing with what was going on with my life or if I was dealing with stress at work, at school, or at home. But if she did, we might have identified what was triggering the hives a lot sooner. I ended up resigning from that toxic job in May of 2018, and the hives immediately stopped. I realized then just how important it is for providers to care a lot more about what's going on in the lives of their patients as they're providing them care and giving them clinical advice. And I took a mental note and decided that moving forward, I was going to be a lot more forthcoming with my healthcare providers. And I was going to share more with them, whether they were Black or white, about what was going on in my life during my medical visits. But I still couldn't help but wonder that maybe, just maybe, if my doctor was a Black woman or a woman of color, and I felt that she could connect with the experience that I was dealing with at work, then I might have shared that information with her voluntarily. Now, back in 2018, I was also in grad school. I was doing quite a lot in 2018. I was pursuing my Master's of Public Health, reading academic journals, and observing how consistent the racial health disparities were across the board. And I always zoomed in on the outcomes for Black women, for obvious reasons, and the disparities were jarring. Black women are plagued with higher incidence and mortality rates for various health conditions. Seeing these stats and getting a deeper understanding of the social factors that result in these outcomes angered me to no end. I would read these journal articles and at times reflect on my own experiences and the experiences of my friends and family members, and at times be so overwhelmed with rage and sadness to the point of tearing up. This happened enough times for me to realize that it was time for me to stop just being angry. It was time for me to get to work. Black women are plagued with higher incidence of mortality rates. Every year, 50,000 Black women die from heart disease, which translates to about 137 Black women every single day. Black women are 3 to 4 times more likely to die from pregnancy-related complications compared to white women. And Black women are also more likely to die from breast cancer and the very preventable disease cervical cancer compared to women of other races. Now imagine constantly being bombarded with statistics and headlines like these that say people who look like you are more likely to die from a preventable disease, only to then realize that there are very, very few places online for you to find health information and resources that center the experiences of people who look like you. Well, that's a predicament that I found myself in and found that many of my peers are finding themselves in, and so I launched Health in Her Hue in 2018, a digital platform that connects Black women to Black and culturally competent healthcare providers, and provides health information and resources that center Black women's lived experiences. Health in Her Hue strives to reduce racial health disparities by leveraging the power of technology, media, and that beautiful thing we call community to improve health outcomes for Black women. Just 2 weeks ago, we launched the beta of our platform, and over 200 Black women signed up for our platform. Black women who are doctors, patients, therapists, doulas, and they're making meaningful connections and having interesting and meaningful conversations in a safe and trusted environment online at the convenience of any device of their choice. Health in Her Hue was born out of my frustrations, observing how our healthcare system fails and continues to fail people who look like me. People from historically disadvantaged groups bear the brunt of our health system's failures, and as a result, many of us are well positioned to identify pain points in our health system and develop innovative solutions to address them. In fact, many of us are building companies to address these failures. Rubicon MD is a great example. The founders, Gil and Carlos, both experienced difficulty getting access to care. Gil's grandmother needed neurological health care and had to keep flying back and forth between Barbados and Boston to get the care that she needed. And this became emotionally and financially draining for the family. Carlos's grandfather, who was living in Spain, was losing his hearing, and there were no providers in Spain that could treat him. So doing his own research, Carlos found a medical device that could help his grandfather. Both Gil's and Carlos's experiences made them wonder, why was it so difficult to get access to necessary medical interventions? They met at an MIT hackathon and began to think, how can we democratize access to medical expertise in places where specialty care is limited? And together, they built Rubicon MD, a platform that allows primary care clinicians to quickly and easily consult with top medical specialists to improve the quality of care that they're able to provide their patients and at the same time reduce costs and inefficiencies. Radical Health is another great example of a pain point turned into innovation. Radical Health is a tech-enabled company based right here in the Bronx and founded by Ashlee who was inspired by two major life events, her mother's cancer diagnosis and the birth of her own son. Despite working in the healthcare industry, Ashlee found herself at a loss having to navigate the healthcare system as a woman of color. So she founded Radical Health, which works at the intersection of community health and tech. And what they do is they combine meaningful conversations with AI-enabled tech that allows patients to better understand their rights during a medical visit and develop self-advocacy. Queerly Health was founded by Derek Reyes, who witnessed how difficult it was for LGBTQ+ people to navigate the US health system. Derek saw the ways in which the US health system largely overlooked and underserved the LGBTQ+ community, and saw the ways in which the digital health industry looks like it was getting ready to do the exact same thing. But they decided that that wasn't going to happen on their watch, and that digital health could actually be leveraged to reduce barriers to accessing care for this community, and eventually eliminate disparities for the LGBTQ+ community. Queerly Health Solution offers a great solution to a major pain point in our health system by offering carefully vetted and trained health and wellness providers who can provide safe and knowledgeable care to the LGBTQ+ community. A liberal, someone who thinks he knows more about your experience than you do, James Baldwin. I know you all are probably wondering, isn't this a talk about healthcare, not political leanings? And you're right, you can breathe, I'm not going Fox News on you. James Baldwin just happens to be one of my favorite writers, and when I was thinking about the topic for this talk, I thought about how this definition can be applied to many startup founders, especially startup founders in the healthcare space. Our healthcare ecosystem is saturated with so many companies founded and funded by people who all believe that they have the best solution for patients. But many of them don't truly reflect or understand the communities that have been impacted the most by our US health system's failures. And now this is not to claim that only people from historically disadvantaged groups have been failed by the health system, because our health system is broken and it impacts everyone. However, we need more people who reflect the communities that have been disproportionately failed by our health system, have their ideas and their companies taken seriously, and more importantly, funded. And I'll come back to this point. But first, I want to encourage everyone sitting in this room or listening to this talk to channel your anger and frustrations at our health system's failures into activation. If you've experienced a pain point or identified a pain point that you've personally experienced in our health system, then you should feel activated to address it. We can see obstacles and failures for what they are at face value, or we can choose to see them as opportunities to improve, to correct, and to innovate. I want more Black, Indigenous people of color. I want more LGBTQ+ people who are sitting on great ideas born out of your experiences to take the first step in writing down your ideas, because they're not as crazy as you think. Trust me. There have been people who've had billions of dollars invested in their crazy ideas. So don't sit on yours. Just make sure they don't turn out like hers. If you feel the passion and are burdened by a particular problem, chances are you're uniquely positioned to address it. Changing systems and structures so that people can live equitable lives is greater than creating some charitable action. Brittany Packnett. Brittany goes on to say that we need two hands. One hand to build and one hand to battle. One hand to tear bad things down, and one hand to build new, good things in its place. Diverse health tech founders need funding for our companies, and we need people to include us in their innovation process. We need more people who have been systematically failed by the US health system to be included in the innovation that is taking place in healthcare right now. We have some of the best solutions for healthcare's most pressing problems. Technology alone won't solve our healthcare system's problems, and innovative ideas will be limited in their impact if they fail to include the experiences and perspectives of everyone who knows how our health system fails and those who understand how it is broken. We don't need any more founders or investors who think they know more about patients' experiences than patients themselves. We need diverse patients and diverse providers who are closest to a lot of these more complicated problems at the innovation table, because the people who are closest to these problems are typically closer to the solution. And I want to also say that pedigree alone doesn't make someone the best startup founders. If we can invest in the Elizabeth Holmes and the Adam Newmans of the world, then we certainly can afford to invest in the ideas and the companies of people, diverse people who have great ideas and who are building companies that address the problems that they have personally experienced. It's not a pipeline problem, it's a selection bias problem. And it's affecting the bottom lines of companies and portfolios, and it's also slowing down meaningful innovation in our healthcare system. And to my fellow diverse tech founders, and hopefully soon to be founders after this talk, may your rage be a force for good, because what you build is infinitely more important than what you tear down. Thank you.